So to understand lung ultrasound, you need to understand three sides, three letters. So A, B, C. So A, B, C. And obviously lung sliding and no lung sliding. But first, so let's see if we have a lung here. This is lung. So A line is what happened because when you put ultrasound probe here, you know, obviously on your chest. So when there is reverberation of ultrasound, what happened is the pleural line, which is here, this is pleural line, will get mirrored because, you know, the sound bounce back 100% because you have a lot of air. So what happened is you would have a mirror image of pleural line like this because the sound bounce. So it's like I'm standing here at the mirror, I see my mirror because, you know, the light bounce 100%. It's the same thing. So A line means there's a lot of bouncing, there's a lot of air in patients. So when the patients come in with dyspnea and have A line a lot, it means they are breathing difficulty from some of bronchial disease, let's say COPD, asthma, or they don't have fluid. Let's say maybe they have PE. So you have A line, it means you have air more than fluid in your lung. So what about if you have PE, asthma, COPD, etc. or normal patient, obviously. What about if you have a lot of fluid? So if you have heart failure, so you have a lot of water here. What happened is that the reverberation would bounce inside of alveolar. So you would have, you know, multiple direction reverberation. It would not be organized like this. So you would have a lot of small reverberation that, you know, include, or this is small reverberation, but it include into one big white vertical line. So this is B line here. So B line happens when you have a lot of fluid in lung, and it's vertical, it's not horizontal. You can see this in any situation that you have fluid in lung. So let's say you have heart failure, you have ARDS, you have COVID, a lot of things, pneumonias, you know. So if you have B line, it means you have fluid, maybe hemorrhage or maybe pneumonia. So this is B line. If you have more than 3 B line, it's abnormal. 3 B line in one rib space. So I'm just going to note here. The third thing is C line. So C line is what happened when you focus. So let's say you have consolidation here. What happened is actually you have pleural line here, and then you have subpleural consolidation because, you know, you have bacteria that eat your pleural space, your pleura. So you have bacteria that destroy your pleura. So you don't have a nice, clean, thin pleura anymore. You have this thick pleura or irregular pleura, and it has this subpleural consolidation and this. So this is C line here. So C line means you have subpleural consolidation, which is black, and then you have a vertical white line. So two things. So this is C line. And if you see this clear white vertical line, which has no subpleural consolidation, this is B line. So you can see C line because it is C, so consolidation. Obviously the things that eat pleural, which is bacterial pneumonia or maybe COVID. So this is A, B, C. When you ultrasound, you know, you can diagnose if you have air more than fluid, fluid more than air, or consolidation. If you have pleural effusion, obviously you see hypoechoic, which we didn't include it here.